Hello, I'm Teresa. I work as a nurse practitioner and nurse prescriber here at 111 Harley St. I do perform mainly non-surgical treatments and I do have more than 10 years of experience in this field. I'm also a tissue variability specialist. That means, in other words, a skin and wound specialist. The most popular treatments here at Harley St are the neuromodulators, as often known as Botox. Also, other very popular treatments are Profilo, PRP, and dermafillers. I'm most renowned for anterior mid-face rejuvenation treatment, which is a dermafiller injection treatment that involves restoring the mid-face. That means restoring the area where we do present sunken eyes, and patients very often come to me complaining of prominent nasolabial folds and tear troughs, and I often offer this anterior mid-face rejuvenation, which is a treatment with immediate results using hyaluronic acid dermafillers. When injecting dermafillers, my preferred techniques depend on, firstly, the areas that I'm injecting, the goal of the treatment, and patient's comfort and safety. So, for example, if I'm doing a non-surgical rhinoplasty, that means injecting into the nose, I'll be using needle technique, and if I'm injecting the lips, because I have to be very precise and I want to reshape the lips, I'll use a needle. However, if I'm injecting the tear trough area, I then choose to inject with a cannula because it's safer, causes less trauma, and less chances of vascular occlusion. The main differences when injecting with a needle and with a cannula are down to the area that is to be injected, for example, the lips or the nose, where I need to achieve more precision. And with cannula, and for those of you who don't know, cannula is a long device very similar to a needle but has a blunt tip. This blunt tip prevents rupture to the main arteries, therefore is safer to inject, and it's my preferred way to inject tear troughs and cheeks and jawline, for example, and even on the hands. The common signs of aging are loss of collagen, and also we need to go back and look to the deeper changes with aging, which are basically bone structural changes like an enlarged orbital rim and changes in the jawline and also in the deep fat tissues of our skin. My preferred treatments to tackle loose skin and anti-aging is, of course, starting with the right skincare regime. After this, then we move forward. We might consider neuromodulators, as often known as Botox, and then biostimulators like Profilo and PRP, which are very, very nice treatments to improve the elastin and avoid the sagginess of the skin. Often, these treatments alone will not achieve the desired look, especially when it comes to the mid and lower face and the neck. That's when I can advise on non-surgical interventions such PDO soft red lifts. These results are immediate and the patients can see the results as they walk out of the clinic, and the levels of satisfaction are very high. The best treatments to restore loss of volume are with dermal fillers, and my preference goes with hyaluronic acid as is reversible with an enzyme. And why would a patient want something to be reversed? In case of complications or undesired outcomes. The place of these injections, it depends if it's an area that is dynamic or non-dynamic. For example, if it's injected in the temple area, is a non-dynamic, so I would be using a very thick filler. If it's an area that is dynamic, like the cheeks, I will have them to use a more dynamic and not as thick filler. Treatment I do recommend for the neck area, it's again starting with the right skincare regime. We cannot forget to address the neck as we are addressing the face in the same way. Thereafter, I would consider and recommending to my patients to use biostimulators such as Profilo to create a new matrix of collagen. By injecting into the bioaesthetic points we are creating this new matrix, will tackle the sagginess of the skin. Thereafter, and after a course of this treatment, there are another options that we can do, and we can consider such PDO soft thread lifts. The treatments for pigmentation, in this case hyperpigmentation, which is also a sign of aging, or sun exposure, excess of sun exposure without sunscreen, can be tackled with mesotherapy alongside with IV drips. With IV drips, we are injecting glutathione and vitamin C. These are the main key ingredients to promote a glowing and a brightening of the skin. We also do mesotherapy cocktails that have at least 50 different ingredients that over a couple of sessions the patient will start to see results. The way mesotherapy combats and fights the signs of aging, it's because in each vial that we are injecting with mesotherapy, we are using different techniques, and each cocktail contains at least 50 different ingredients. All of this are to stimulate the fibroblasts to create more collagen, and this will promote and create an instant glow and hydration to the skin. My top 3 treatments are the anterior mid-face rejuvenation, the hand rejuvenation, and the lip fillers, as I do see immediate results, and I can actually see the patient's immediate satisfaction as they walk out of the clinic and how grateful they are after having this treatment.